Because I think that one of the greatest missing pieces in this conference has been the question of political leadership. Without political leadership, it will not be possible to turn the scientific discoveries that we have heard about into public health interventions that will save the lives of millions of people. So unless we find political leadership, and unless we interrogate the reasons why there is not political leadership, then our response to the AIDS epidemic will be doomed to being less effective than it could be. So what I want to talk about this morning is the importance of political leadership. I want to show you something of what has happened in South Africa looking back. I want to talk for a few minutes about China looking forward. I want to talk about the duties that I believe arise from the recognition that HIV is a human rights issue, where I'll argue that it's not sufficient to merely pay lip service to human rights, but there are active duties that flow from all this talk about human rights. I want to talk about the responsibility of government and the responsibility of society. Much of the first 25 years of the epidemic has been spent creating the means. But we don't want science for science's sake. We want science for public health's sake. We want science to save lives. And I'll say that this is not just a matter that should preoccupy so-called activists. Every health worker needs to be an activist. Every scientist needs to be an activist. Because your duty doesn't stop with the discovery of an antiretroviral drug or a microbicide. It stops at the point that those discoveries are made available to the population generally. So let me tell you a tale of two countries briefly. South Africa, my own country, 5.54 million people officially living with HIV. China, 650,000 people living with HIV, but with a terrible projection of 10 million people living with HIV in China within 4 years' time. And I want to talk about these two countries briefly because I believe that they show what happens without political leadership and what may happen if there is not political leadership in China. One of the things that has struck me, and Peter Peart referred to it yesterday, is tragically how much we have known about this epidemic over the years and how little we have acted on it. In South Africa in 1990, a leader of the ANC who was tragically assassinated a few years later said, "We can't afford to allow the AIDS epidemic to ruin the realization of our dreams." In 1991, researchers pointed to the epidemiology of HIV, showing how South Africa's apartheid migrant labor system could create an environment in which HIV would rapidly spread from so-called risk groups into the so-called general population. Peter Peart said we had the resources. I would say that if we had the will at a much earlier stage, we could have saved many, many thousands, potentially hundreds of thousands of lives. But in South Africa, we haven't had the political will. In South Africa, we have fought over HIV, over whether HIV causes AIDS, over whether antiretroviral drugs work or whether they're poisonous, over whether nutrition works, and so on and so on. And as we've fought, and as we've failed to provide the leadership that is necessary, inexorably this epidemic has grown and grown. And as you can see on this slide, the latest official antenatal statistics show HIV prevalence amongst pregnant women of 30.2%. But even more frighteningly is the deaths that are happening now. This slide is an official statistic produced by Statistics South Africa in our country. It's based upon counting the annual number of recorded deaths based on medical certificates on death. It shows that by 2004, 567,000 people were dying per year, as opposed to 319,000 people per year in 1997. And as you can see, it shows the perverse situation that in my country, more people die between the ages of 20 and 30 than between the ages of 60 and 70. Now, I want to make some hard comments about that, and the comments that I'm about to make are difficult for me to make, but I will make them all the same. It's likely that in the next 2 minutes, what I say, I will be accused of being disloyal to my government and unpatriotic. But what I want to say is that when we fought apartheid, we treated apartheid not as a matter for South Africa alone, but as a matter for the global community. AIDS is a health issue that is not a matter for South African government alone, but a matter for the global community. When this number of people are dying in the face of anti-leadership and political denial, then the world has to speak up, and the world is not speaking up. I want to say now that I believe that our Minister of Health should resign. I say that not because I'm disloyal, but because I'm loyal to these people, to the people who are dying at this very minute in poor communities throughout our country and are being deprived of medical services and access to healthcare services. That is a human rights violation, and that cannot be tolerated, and it has to be stopped, and you have to help us to stop it. Silence equals death. This is what our President said in February this year in the face of the knowledge of the mortality that is taking place because of HIV. It is unacceptable. It is tragic. My last few concluding comments turn to another country, China. UNAIDS has pointed to a rapidly expanding HIV epidemic, the possibility of 10 million new infections by 2010. China is very similar in certain circumstances to South Africa. We know who the risk groups are. The epidemiology has been projected. We have internal and external migrancy, we have gender inequality, and we have a government that in many respects has other priorities than AIDS. The question is, will there be 9 million new HIV infections in China in the next 4 years? Will we allow that to happen? Will the global community allow that to happen? It could take place relatively unnoticed. 10 million people would be less than 1% HIV prevalence. It could take place because there's a culture of impunity for human rights violations in the world. It could take place because statistics dull us to the pain and suffering of dying of AIDS. So we need concerted efforts for prevention and treatment. And the record of the Chinese government so far is cause for concern. There's the blood safety scandal. There's the imprisonment of millions of women who are sex workers. There's harassment of civil society activists, imprisonment of people who petition. Almost in conclusion, I want to turn to the question of human rights. The tragedy for people vulnerable to or living with HIV is that the political response to HIV is influenced by the geopolitics of AIDS. When Kofi Annan visited our country in March 2006, he praised the government for many things correctly, but he didn't attack it for its response to AIDS. We need leadership from people like Kofi Annan. This is almost my final slide. This is about the right of access to healthcare services. Compare mortality in South Africa with mortality graphs in the United States and Sweden. This is 21st century Earth, and this is wrong. And this is why, as a matter of human rights, we have to make sure that everything is done to try to ensure that people have access to treatment. I'll skip my last 2 slides. My concluding question is, we have the means. We've heard in this meeting, we have the means. Will we utilize them? Will we tell the truth? Will we actually ensure that targets are set and monitored and maintained so that in the next 2, 3, 4, 5 years, real progress is made and real political leadership to confront this epidemic is discovered? Thank you.